find out, because my guest for our podcast, our Cancer Education Series, is none other than Kelly Sittig. And Kelly is the Executive Director of the Iowa Cancer Consortium. Welcome, Kelly.
Thank you so much.
So Kelly has been with the Iowa Cancer Consortium for 10 years and has been its executive director for 5 years. And I also am on the Iowa Cancer Consortium. So we're going to do kind of a deep dive into what the heck is the Iowa Cancer Consortium, what is cancer control, and why should you, watching this show, be a member of the Iowa Cancer Consortium and help us create a world with less cancer. So welcome, Kelly.
Thank you so much for having me.
So Kelly, tell us a little bit about yourself. I know you grew up in Waterloo.
I did.
Okay, what was your claim to fame in high school?
Would you believe it was playing the clarinet? Yes.
And the marching band and the symphony.
Band. Yeah, exactly.
Okay.
Yep. And I even played into college. And there was a while where I thought that's what I would do with my life.
Be a professional clarinet player.
Yes. Can you believe
like
it?
a Benjamina Goodman.
Maybe. Yes. Maybe. Didn't end up doing that, obviously.
Okay.
But
so what would be your all-time favorite number to play on the clarinet?
Oh my goodness, it's been so many years. Copeland wrote a very gorgeous piece for the clarinet, and he's one of my favorite composers anyway, so that is a fond memory.
Aaron Copeland.
Yes, yes, exactly.
Okay.
Yeah.
And then you went to University of Northern Iowa.
Yes.
Okay.
Yep, I
Go
did.
Panthers.
Go Panthers.
Good.
Yes.
So, and now you are Executive Director of the Iowa Cancer Consortium.
That's right.
So how would you explain to someone who doesn't have a clue, what is the Iowa Cancer Consortium?
Yeah. Well, I'd like to start by saying and reminding everybody that cancer, as we know, is a really complicated and costly disease. It's something that is so complex that it's very hard to address alone. And so the Iowa Cancer Consortium and other coalitions like it across the country exists to help people find partners, collaboration, build their ability and capacity to do their cancer control work, and basically just find more resources and people to work with in order to do cancer control work.
And it's kind of fighting cancer from every possible direction.
Yeah, exactly. And it's very led by coalition members. So we're really lucky here in Iowa to have a big cancer control coalition. We have about 500 members across the state right now. And we like to think that every additional member is like another opportunity for all the other members to potentially find a collaborator, to build their own networks, to learn and share best practices with.
Now, you used a phrase several times, cancer control. So you and I use that phrase, but what is that phrase, cancer control? What does that mean?
Yeah, great question. And it is complex. Like I said, sometimes we talk about something called the cancer spectrum, the cancer control spectrum. And what that is if you can imagine any type of work or advocacy that goes into reducing what we call the burden of cancer, it's involved in cancer control. So it's everything from risk reduction to cancer prevention, to finding cancer at its earliest stages through screening, through treatment, through quality of life, everything that is encompassed in work that can make things easier for people who might be facing cancer someday or are currently facing cancer. It's looking at economic impact. It's looking at, community impact. It's all of that in one package, and that's what we call cancer control.
Yeah. Excellent. So, it's not just about, finding the cure for cancer.
Right.
That cancer control, as you clearly pointed out, is everything from preventing cancers that are preventable, making sure that we find cancers at an early stage, that patients have access to the best possible treatment, that we are also about quality of life while they're going through cancer treatment. We're interested in survivorship issues. We're interested in anything that can help reduce the burden of cancer
Right.
from every possible perspective.
Yes, absolutely.
Yeah.
I think we all know that cancer is a burden. It can be a burden individually. It can be a burden in a family. It can be a burden in a community. It can be a burden in the state. And it certainly is in our state and others. And so we're looking at ways to address that burden.
And Iowa Cancer Consortium is the name of Iowa's cancer control organization that is funded and actually mandated at the federal level through the Centers for Disease Control. So some of you may think about the Center for Disease Control and the role it plays in infectious diseases, for example, COVID or any number of infectious diseases, but actually cancer is one of the diseases that the Centers for Disease Control has an office and does work around and helps to fund each of the 50 states to have an organization within the state that is responsible for developing a plan of action for the state to help reduce the burden of cancer or to help control cancer. And that's the Iowa Cancer Consortium.
That's exactly right.
And you're the executive director.
I am, and I love it. I love it because there's so many amazing people who are working in cancer control.
And so you said there's over 500 members.
Yeah.
So give us an example of the different types of members.
Sure. It's a wide range, as you can imagine. Just like cancer control is a big area. We have people like you who are practicing oncologists. We have people who are public health professionals. We have cancer center administrators. We have cancer survivors who are passionate about advocating for cancer issues or who want to help tell their story in order to help others not feel as alone, or to help researchers make connections. We have researchers who are part of the Cancer Consortium. It's really a huge variety of people who are all coming to the table for different reasons, with different motivations, different needs, but who find value in that collaboration.
And I would throw out a few other examples.
Yeah.
We have people involved in public health that are members of the Cancer Consortium.
Exactly.
We have cancer centers that are, sort of organizational members.
Great point.
We have other 501c3 organizations like the American Cancer Society, Above and Beyond Cancer, Leukemia and Lymphoma, Komen, the other organizations that are also involved in fighting cancer that are members of the Iowa Cancer Consortium.
Yeah, that's a great point. I mentioned that we have 500 members, and that's really, we're counting individuals. But within those individuals, they represent formally around 50 organizations who have, again, formally come to the table to be members of the consortium at an organizational level because they feel that it's valuable to be aligned with state cancer control work. And then, even if we think about those 500 individuals, many of them represent additional organizations who may not be organizational members of the consortium, but who are just as invested in cancer control across the state. So the network is pretty broad.
Yep. And it's not just a group that gets together and drinks coffee and talks. I mean, so correct me if I'm wrong, but one of the mandates, one of the requirements, and the reason the federal government, through the Center for Disease Control that we refer to as the CDC, one of the requirements is, hey, you are a funded organization. We want you to have a plan, a cancer plan for your state. Tell us what is it you're going to do collectively as a state? What are you to help improve outcomes? And by that is, try to reduce the risk of cancer, reduce the number of cancers, and improve the number of patients that are survived by cancer, improve access, improve outcomes, quality of life. So let's talk a little bit about the cancer plan.
Great. Yeah, so exactly like you said, we often talk within our program about the 3 Ps. And so the partnership, which is the Iowa Cancer Consortium, is one of those Ps. We have a wonderful comprehensive cancer control program that's housed at the Iowa Department of Public Health, so at the state level. And then the 3rd P is the plan, or the Iowa Cancer Plan, as we call ours, of course. And as you said, that is really meant to be a roadmap for anyone who is working in or advocating for cancer control of some sort. We talked about that cancer control spectrum, so which we often think of as prevention through quality of life. And our cancer plan here in the state does include 4 priorities that align with that spectrum. So prevention, early detection, treatment, and quality of life. But it also includes a 5th priority, which is health equity, because we as a coalition recognize that it's very important that everybody have the same opportunity to achieve the best outcomes in their cancer experience, or their access to preventive services or screening services. So our plan is, it revolves around those 5 key priorities. It's important to mention too that the plan for Iowa, just like every partnership is in every different state, every plan is very different, every state cancer control plan. And in Iowa, we have made our plan to be used by, again, anyone working in cancer control or advocating for cancer control issues. So within those priorities, we have experts who are part of the coalition and part of communities who have helped us identify the key goals that we have for our state and issues that Iowans and our state of Iowa face. And then we have action steps and measurable targets. And it's a wonderful advocacy piece beyond being an evidence-based tool for folks who are working in cancer control, but it should contain most of what we need to do to truly reduce the burden of cancer.
And I don't mean to put you on the spot, but to give some concrete examples. So in the prevention, do you recall what some of our goals are, what our current plan, how we articulate a specific measurable goal, and where we what data we look to support whether or not we've achieved the goal?
It's a great question, and actually a really timely one, because we're getting ready to revise the cancer plan. We've been talking a lot about how to most effectively make the cancer plan measurable and useful in that way. So an example of measurable prevention goals might focus on something like physical activity and nutrition. So making sure that people have access to physical activity options, to healthy foods. It might include something like access to UV protection services and tools. And then the measurements really depend on what the specific area is.
Do you remember, does our current plan, before we undergo the revision, talk about the HPV vaccination in prevention?
It absolutely does.
So there's a specific something very specific. So for those of you, we've had talks about it, but to remind you that the HPV virus, human papilloma virus, causes about 6 or 7 different types of cancer, and we have a vaccine for the virus. So the most common one that people most commonly relate to is cervix cancer in women, but there's actually more tonsil cancer in men caused by HPV than the cervix cancer in women. So those are 2 of the numerous types of cancer caused by the HPV virus. There is a vaccine for the HPV virus that will prevent cancers. So we're talking about the cancer plan saying, let's prevent more cancers in Iowa. So one very specific metric is, let's look at the percentage of eligible children, adolescents, that are eligible for the vaccine, and what is the vaccination rate. So that's a goal. And then the coalition, the Iowa Cancer Consortium, works with many of the partners. Well, okay, what can we specifically do throughout the state of Iowa to help improve the vaccination rate, which will then result in more cancers being prevented, meaning fewer HPV-mediated cancers happening. So one very specific example.
Yeah, that's a great example. And our state has done some really good work, collaborators within our state around trying to increase HPV vaccination. It's a great example. We've worked with, Mercy has done some wonderful work at increasing HPV vaccination rates. We've worked with different clinics in different geographical areas. There are some great researchers in Iowa who are doing wonderful community-based work as well. Yeah.
And as you mentioned in prevention, and we've talked about it many times in the Cancer Education Series, that almost 50% of cancers in the United States are caused by things that we can reduce the risks if we maintain a normal body weight, eat healthy foods, and exercise. You actually prevent cancer. So one of the things Cancer Consortium is members come together. What can we do together collectively to improve nutrition across the state of Iowa, to improve the number of individuals who have a normal body weight, and to make sure that people from kids in elementary school to seniors have access and the ability to engage in vigorous physical activity. So those are activities that are also part of the Cancer Consortium.
Absolutely. And I'm glad you mentioned that school age span, because what that makes me think of too, especially around physical activity and nutrition, is policy and systems change, which is so important, especially for issues like that. Changing policies, whether a little p or a big P, changing systems so that people can exercise more.
Yeah. So an example would be, what if schools like eliminated PE? Well, that would be a system. Hey, we, the Cancer Consortium, are working with partners and maybe legislators. Those are other partners of the Cancer Consortium. Let's mandate that kids get physical activity, because if physical activity isn't provided in school, then the idea that once you get out of school, you're going to make it part of your daily routine. So those are some of the policy issues that we might deal with prevention.
Yes, exactly.
And we could spend we could spend hours on the actual cancer plan looking at prevention, early detection, treatment, quality of life. But I want to pivot to the fifth aspect that really is sort of the lens that we look at the other four, and that is the term you used, health equity. So tell us, what does that mean, health equity?
Yeah, that's a great question too. So you mentioned earlier in our conversation, we want to make sure people have similar access to screening services, let's say. But we know that not everybody does have the same access. Maybe some folks don't have access to transportation to get to screening appointments. Maybe people don't have health insurance that would cover preventive screenings. So we're all looking at cancer and prevention all the way through treatment, quality of life from different places in our lives. And what focusing on health equity does is gives us the goal of having everybody be able to access the highest quality of prevention, screening, treatment, quality of life. So we want everybody to have the opportunity to access the best services and experience possible, regardless of their life situation or background. Yeah.
And so to get specific, regardless of gender, regardless of race, regardless of socioeconomic status, regardless of the location you live in. And we know, and we've also talked about social determinants of health, and how the zip code you were born in is more predictive of how your health will be 30 years from now than knowing your entire genetic code. And that those factors that we call social determinants, socioeconomic, that include all of the things I mentioned and probably a few more that I didn't, affect are you getting prevention services?
Right.
Are you getting good nutrition? Do you have access to screening? Do you have access to quality health care? Are you really getting all of those services? And that we look at every aspect of the cancer journey or the cancer plan, from prevention to early detection to treatment to quality of life. How can we make things, those who are disadvantaged, how can we help reduce the barriers?
Right.
Because we know that right now the outcome, for example, of an African American is much worse than the outcome of a Caucasian
Right.
in the state of
In
Iowa.
Iowa, yes.
We know
Yep.
absolutely that's true.
Yeah.
So what can we collectively do to help reduce the disparity?
Right. Yes, exactly. And I mean, I think step one, right, is shout out to Dr. Mary Charlton at the University of Iowa College of Public Health for producing the recent Cancer in Iowa report. It was last year's Cancer in Iowa report, actually, that did show those racial disparities within our state, because that's step one, right? Knowing and being able to show that we have issues. I think that was really important to a lot of folks. So she was able to show what I think a lot of people intuitively knew, that there are disparities between Black and white Iowans and their mortality and incidence outcomes for different types of cancer.
Yeah. So what we're saying with the health equity is that some areas of cancer control need a focus around those individuals, those groups that clearly have worse outcomes.
Right.
So that we would be doing a disservice to the state of Iowa if all we focused on were wealthy Caucasian women who have insurance.
Exactly.
And trying to just focus on how can we make their treatments better or easier. That would not help reduce the burden of cancer as much as how do we make sure that an African American woman living in a county that doesn't have a lot of places to get mammograms can get the screening mammograms. That would make a bigger difference.
That's right. Yeah, there's a phrase, a rising tide lifts all boats. And I think that's a really good way to look at health equity. If we can make things, and evidence shows this, if we can make things better for the people who are struggling the most, things are going to be better for everybody. And so looking with a health equity lens and making sure that we truly are helping everybody within the services and outreach that we're providing is incredibly important for every single Iowan. And it's not just, racial disparities. We see here in Iowa, we have a lot of rural residents. We're a highly rural state, and that can lead to a lot of different access issues. We've talked about transportation, which is huge for a lot of rural Iowa patients. We also know that folks who identify as LGBTQ use tobacco at higher rates. And have other disparate cancer outcomes as well. So it's not just racial disparities, but we really need to be looking at all sorts of disparities. Often when we're talking to people, members and partners who are looking at developing programs, we just really what this means is taking a look at the programs and services that are being provided and making sure to take a moment to think about who am I not reaching, who is not included in what I've outlined here, the services that I'm providing, and then trying to adjust programs and projects just a little bit in order to include as many folks as possible, and that's working towards health equity. Yeah.
So one thing I should say for total transparency, I'm a member of the Iowa Cancer Consortium. I happen to have the honor of serving as the vice chair for the board of directors for the Iowa Cancer Consortium. Dr. George Weiner, who is the medical director, who is the director of the Holden Comprehensive Cancer Center at the University of Iowa, serves as a chair. So one of the ways, here we are, this organization mandated by the Center for Disease Control to come up with a cancer plan and reduce the burden of cancer in Iowa. And what's our budget to do all of that?
Well,
approximately.
The consortium
Yeah.
is around $600,000.
So around $600,000.
Yeah.
So we have about $600,000 to do all of that.
Yeah, this
so,
year.
So what do we do with the money?
Yeah,
and so one of the things that I want to talk about a little bit is the grants.
Yeah, great.
So how does the Iowa Cancer Consortium use some of that money to get it out into the communities to help achieve the cancer plan of improving, preventing cancers that are preventable, making sure early detection is done, making sure treatment happens. You don't buy a whole lot of cancer treatments for $600,000.
Right. That's very true. Yep. And that's true. Well, it starts with the cancer plan. And that's why we want to make the cancer plan as useful to as many people as possible and include as much in that cancer control spectrum as possible about reducing the burden of cancer. Because one of the things that we do is we do provide grants to members and other partners to do cancer control projects and enhance programs within their own organizations or communities. And they're called Iowa Cancer Plan Implementation Grants because the purpose of them is to implement something within that very vast comprehensive plan. So if a public health department, say, wanted to work on increasing community HPV vaccination rates, they're going to find support and potential measures for that within the Iowa Cancer Plan. And so they could,
for example, Polk County Public Health could apply for a grant.
Yes.
And they would need to demonstrate, here's what we would do with that money to, for example, to help improve vaccination rates and then this is what they would do. Exactly.
Yep.
And so an example, another organization that I'm familiar with, Above and Beyond Cancer, applied for and received a grant. Maybe let's talk about that as just one example of a cancer plan implementation grant that is designed to showcase how do you do something that might address some of the barriers and disparities.
Yeah, great. Well, we talk a lot about trying to fill gaps in cancer control. And that is exactly what Above and Beyond Cancer is doing with their grant this year. And we've talked about transportation as an access issue. And so this year, Above and Beyond is working to fill a gap, specifically in central Iowa right now, not specifically in transportation, but in housing or lodging for cancer patients. So not only do people struggle to find rides to treatment, but they often need a place to stay, and that can be incredibly expensive. So Above and Beyond is working with area hotels in central Iowa to develop partnerships for free and reduced hotel stays so that cancer patients, that's one less thing that they have to worry about. And they're developing it in such a way that it'll become a sustainable program, potentially replicable across the state, which is really wonderful. We require projects like this to be collaborative, and this one clearly is in the way that it's pulling in non-traditional cancer partners like hotels. You wouldn't think that when you think cancer control, you don't necessarily instantly think a local hotel, but non-traditional partners like that are absolutely needed. And so Above and Beyond is doing such a beautiful job of building those partnerships and truly filling a gap for cancer patients.
And as you said, what we really hope will happen with the grants is that the recipient of the grant will demonstrate success in the program, and that program can then become a tool that other parts of the state might be able to implement. Could you give us an example of another one of the grants that we awarded the last cycle, and what, just as an example of an award and what type of issue they're working on?
Sure. We have quite a range. So usually we don't generally fund, like you said, $600,000 doesn't fund a lot of treatments. But we will occasionally, if there's a great health equity focus, help people get the treatment they need, or the preventive services that they need, to help the organization, again, build a more sustainable program and way of doing outreach. And so one grant that we have funded this year is with Promise Community Health over in the western side of the state. They have a wonderful outreach program with women who are generally underrepresented, or who have been pushed to the margins, don't have health insurance or are underinsured. And they have been helping them access breast health information and screening mammograms, and then helping them navigate through if their screening mammogram shows that they need further diagnostics and treatment. So that's one example, again, focusing on helping people who may not have the most access, and they're working with community partners in that area to do that. Another example that I think is so beautiful is we've provided funding to an organization called Living Proof Exhibit, which also I think a lot of folks might not think of when we're talking about something like cancer control, but they're an art-focused group that is all about the impact that creating and experiencing art can have on the lives of people who are going through cancer treatment. And it's really wonderful. During the pandemic, they developed art to go boxes, and were able to send those out across the state and received such positive feedback and input about the way that brightened people's days. And that's a really important quality of life issue.
And that's sort of the pillar of quality of life.
Right, exactly.
That's addressing. So,
yeah,
so we've talked about potential plans that might help in prevention, in early detection and treatment, and in quality of life. Let's talk a bit more about the revised cancer plan.
Yeah.
So typically when someone develops a strategic plan or a cancer plan, it's forward looking.
Right.
And often it's done in increments of 5 years or 10 years. Refresh my memory, is it mandated for 5 years?
Nope.
By the
we
CDC?
all get to decide.
Well, we get to decide at which how often we go through a revision.
Right.
So we're in the process of bringing stakeholders. Stakeholders just means someone who cares about reducing the burden of cancer together to say, what are the goals we are going to set for the next 5 years? And then what are the measures what are we going to be looking at? What are we going to measure? And what are we going to do to try to achieve those goals?
Exactly. So our current plan runs through this year. So we are in the middle of revising. We think that we have a pretty great plan, but 5 years is actually a really long time these days, especially in something like cancer control and technology and advances in medicine. And obviously, the world is a much different place now than it was 5 years ago. So there are revisions that we definitely need to make. And yes, we gather as many people who have input to provide. So anyone, again, from researchers to public health professionals to people who are delivering cancer services directly to Iowans, to the Iowans themselves. I mean, patient stories and survivor stories are so key to this work, because it doesn't matter if we don't know how it only matters if we know that we're doing right by the people who are experiencing it.
So you don't have to be in a profession that takes care of cancer patients or is involved with cancer. Anyone who has an interest, either because of their own personal cancer journey, the cancer journey of a family member, or who's just really interested in making Iowa as healthy as possible and interested in preventing cancer. Because the good news is the things that help prevent cancer also help prevent diabetes and heart disease and strokes. And so really anyone has a stake here. So how would someone who's listening to this evening, who wants to be part of the Iowa Cancer Consortium and or part of designing the cancer plan? How would they get
Yeah.
involved?
Yeah, great question. So we have a pretty comprehensive website, and it talks about everything we've talked about tonight, and that's
Maybe let's show that website address.
great.
Right
Yes,
now.
and that's www.canceroiowa.org. And you can find links to the cancer plan on that website. You can find a place to sign up for emails there. Those are really good starts. So let's talk about the
And you
cancer.
become a member.
You can, yes.
Oh, that must be really expensive
It
to be a
is
member.
$0
$0
to
okay.
$20
Okay.
per year for an individual. So
anyone can become a member.
Absolutely anyone.
So I was thinking it was $10. Did we?
You know, it's 0 or 20.
0
well,
or
we
20.
do have student memberships, I believe, for $15.
Okay.
Yes.
So it's $20, but that if you have if the $20 is if that's a barrier, then you can request the $0 membership.
And you don't even have to request it. You just click that button on the website. Nobody has to know. You just and it's exactly like paying the $20. We don't want any sort of we don't want money to be a barrier at all.
So that we don't use the membership as a means of gaining money. So we really want people to be members and to be engaged. Now, another way of engaging with members is through meetings. And traditionally, we've had annual or semi-annual meetings that might focus around a particular subject. And we have a meeting coming up here soon.
We do. Yes. So when you go to the website, canceroiowa.org, and you become a member for $0 or $20, you can also attend our upcoming or register to attend our upcoming spring meetings for free as a member. And they're focused on cancer plan revision. So we were just talking about how important it is to have everybody's perspective at the table for the cancer plan revision, and how we really do look to Iowans of all experience and interests to inform the cancer plan. So April 13th and 14th, we have 2 meetings you can choose from. They're just an hour and a half long, virtual. You can choose one during the daytime or one in the evening. So hopefully that will hit everybody's schedule. And it'll be an hour and a half of talking, facilitated conversation about what needs to be changed or added to the current Iowa Cancer Plan. And it's also a really great, our meetings, so the spring meetings, and then we have a conference in the fall called the Iowa Cancer Summit. Those are incredible ways to make connections with other people who are passionate about similar things as well. So people can attend those.
So one question I have, and I should know the answer to this, but are we hoping to have in person this fall?
We are hoping. So we have said October 25th is the date in Ankeny in person.
And like a lot of things, it may end up being like a hybrid. So anybody who goes to meetings now, they used to be all just in person, and then it was only just online. And now it's kind of, will it be hybrid? But hopefully we're hoping that the COVID situation will allow us to come together in person.
Yes. And we really try to make that summit a wonderful learning and networking opportunity for, again, people from all experiences and backgrounds. That's a great way to connect with folks also. So keep your fingers crossed that we're together in person.
So I know that the work we do as a Cancer Consortium, we often, instead of everybody always just talking about everything, we have work groups where we get individuals who may have a special interest in a particular aspect of cancer control together. Can you tell us what those work groups are?
Sure.
And then maybe we can go work group by work group and sort of describe what's some of the work that happens in a work group.
Yeah, that's great. So we have quite a few that are meeting right now, and they're quite a range. So we have research and clinical trials. We have a policy work group. We have colorectal cancer. We have quality of life and HPV and radon. And then we also have health equity and a rural work group. So all very topic specific. And the way we identify that there's a need for a work group is through coalition member interest. So often a coalition member will say, hey, why don't we focus on this a little bit and gather people who are interested in the topic and see what collaborative opportunities there are. And so that's why we have those specific topics right now. It's very member led.
Okay. And let's take, we don't need to go through all of them, but let's, for example, rural.
Yeah.
What are some of the issues that are being dealt with in the rural work group?
That's a great example because it's one of we fondly call it our baby work group. It's a newer work group. It's really come at a very timely, rurality has always been an issue for us here in Iowa. But we have people who are very passionately collaborating around that area. A lot of the folks in that group are from rural health systems or rural hospitals who are providing cancer care in rural communities. We have some wonderful researchers who are doing research with those rural hospitals to provide support for those organizations. And then we have people who, again, from that patient survivor perspective, who can provide that type of input. And the work of any work group really depends on the specific interests and needs of work group members. So we like to think of our work groups as having kind of like a spectrum. From on this end, the members of the work group really just want to place a way to meet and stay in touch with what's happening with other groups and organizations and individuals around the state and to learn from each other, all the way to we're going to focus on one project together. Most of our work groups right now are down here. And I think that's partly because of the pandemic. People don't necessarily have extra capacity to work on another project specifically together, but they are desperate for connection. And so right now, most of our work groups are really providing that professional advocate connection opportunity for folks so that everyone is still tapped into what others are doing. And then we generally have some coming.
And it can be like sharing of best practices.
Right, exactly.
Like so,
Yep.
So the rural group might be various rural hospitals that come together and share best practices. I know that a topic that really advanced during COVID was telehealth.
Right.
So we talk about telehealth for a long time. It wasn't until during the pandemic where Medicare and other payers of healthcare said, we will pay for telehealth, and that expanded telehealth. And when you're in a rural community where access to even basic healthcare can be difficult, but access to specialized healthcare in the rural community can be very difficult. So that a lot of discussion around telehealth as a means of enhancing healthcare in the rural community.
Yep, absolutely. And I think that, our rural work group, for example, is one place where administrators and providers in different rural hospitals can come together and talk through different issues like that they're facing. It's a place for them to hear from their peers and to connect with other experts. And often, even if the work group isn't working together on one specific project as a work group, we generally see almost like little planet projects and collaborations happening around them. So people who've connected in the work group and then are able to work collaboratively in other spaces as well.
Okay. So one of the work groups is the policy work group.
Yeah.
And so we recently had a success, and we probably can't take full credit for the success as the Iowa Cancer Consortium, but many of the members of the consortium, including the American Cancer Society and other advocacy organizations that are also concerned about policy, came together. So Iowa Cancer Consortium long has had a focus about the effect of radon in the state of Iowa on as a cause of lung cancer.
Right.
So we have been working on radon as an issue for many years in terms of public awareness and education and actually then to the point of having bills in front of the state legislature to help create public policy to reduce the risk of dying of cancer because of radon.
Yeah. Yes, I think so. The bill that you're referencing now, or the success that you're referencing, is such a beautiful story of collaboration, actually. And I definitely want to be clear and say that the consortium doesn't support or otherwise any sort of specific bill. So we're not doing any lobbying ourselves at all. We will advocate. We will help people understand what evidence-based issues are around cancer control. But so while we didn't specifically push to have this bill passed, we certainly provided collaborative spaces for people who were working
and
on
many
it
of the
to connect.
members who aren't as restricted in lobbying as the Iowa Cancer Consortium did go up to the Capitol and lobby.
For sure.
So so one of our favorite people in the world, and she was a patient of mine and a longtime member of the Iowa Cancer Consortium, Gail Orcutt. So Gail was a teacher and a never smoker, and developed a lung cancer, and learned only after her own lung cancer diagnosis, like, why did I get lung cancer, that radon is a cause of lung cancer. And then learned that, yes, her home had a very high level of radon, and became a mission for her to educate people about the health effects of radon, to know about it, to test your home, to mitigate, and then to do something in terms of public policy to help make sure that everyone had the opportunity, and especially as a teacher, children in schools. A couple of years ago, Gail died of her metastatic lung cancer. And the bill that was in front of the state legislature this year was the Gail Orcutt radon safety bill to require schools to test for radon. And lots of individuals, cancer survivors, other individuals who are currently going through stage 4 lung cancer caused by radon came together, along with organizations like the American Cancer Society Cancer Action Network, which does do lobbying. And many individuals, myself included, went up to the State House and met with our senators, met with our representatives, and advocated for them to pass the Gail Orcutt radon safety bill. And it was successful.
Yes, so partners are still waiting on that governor signature.
So we're not done advocating.
Right, not quite yet.
So we got it through the House. We got it through the Senate. All it needs now is a signature of one person. So write the Honorable Kim Reynolds to please sign the Gail Orcutt radon school safety bill. That's the only thing that we need now to get this bill into public law. And I like to say that, as a cancer doctor, I can, one patient at a time, help reduce the burden of cancer. But all of us, through public health and public policy, if we pass this bill, we can save lots of lives. So that's one of the things that we've been working on through the policy work group at the Iowa Cancer Consortium and at the American Cancer Society Cancer Action Network.
Yeah, I mean, ACS the American Cancer Society Cancer Action Network, definitely they were leaders.
Sort of the leaders.
Yes, leaders, yes. And a lot of folks at the American Lung Association worked really hard on that bill. Again, the consortium certainly doesn't and can't and won't take credit for all of that hard work or the bill itself, but I think it's a beautiful show of collaboration and what collaboration can really do. Collaborations around radon that I think ultimately may have influenced this bill have been happening for 10 years.
Yes.
Yeah.
Yeah. Gail worked on it for 7 years. And, you know, anyone who's worked in public policy, you know, some year you just get a subcommittee hearing and it doesn't get out of the subcommittee. And then the next year you might get a committee hearing and then, you know, years go by and then all of a sudden it passes unanimously through both houses. So we're looking forward to getting that signed. So we're going to start wrapping it up. And one thing that maybe we should have started with, but it's good to end with, what is the mission statement of the Iowa Cancer Consortium?
Yes, we are working to enhance cancer prevention and control through advocacy, equity, and collaboration.
All right.
In Iowa.
And let's put it up the screen again with the email, excuse me, the web address, so that anyone can go to the website to learn more about the Iowa Cancer Consortium, become a member for either $0 or $20 to become part of the Cancer Planning Committee and to attend the spring meeting. So all of that's available through canceriowa.org. Now let's open it up to questions. So we got some folks here at our live studio audience, and we also have questions that you can submit if you are watching this via live stream. So questions, here we go.
Can you give us the address for the governor, the website?
We can sure connect you.
Oh, I think we can.
Yes,
I
okay,
think we
Jack.
can.
put it
I
up
think
on
it's
the
very
screen.
easy to find
Yeah.
the email for the governor. And so before the evening is up,
Great
you
question.
will have that. I will give you the email for the governor.
I have a question, concerning, when you say you have, cancer, certain zip codes and that, and you talk about that as a social issue, but is it also possible that you're looking at, say, air quality, water quality, or even food that, that is actually within that particular area?
Mm-hmm. That's a great question. And I think the answer is yes. And all of those things really can go into what a person's cancer prevention abilities are, what their quality of life is overall, what their cancer experience and outcome. And I think it's referred to as social determinants of health. And I think that's because, those are all aspects of where we live and our community. So I think all of those things can come into play when looking at zip code and cancer outcome. Did that answer your question? Okay. Great question. And maybe Dr. Deming has more to say about that.
I'm sorry, I was looking up
You're
the
looking-
address. So
No, that's important too.
So go to the governor.iowa.gov. So governor, GOVERNOR .iowa.gov. And that will give you 3 different ways of reaching the governor. You can send an email through that website. There's a phone number to call to talk to one of her representatives to recommend signing. And the third option is a snail mail address for sending an old-fashioned letter. So all of those are there, the phone number, the snail mail address, and a place where you can actually send an email advocating for the Gail Orcutt radon school safety bill.
And I would add too, if advocacy is something that you're interested in, the American Cancer Society Cancer Action Network is a wonderful organization to get involved with, and you could probably find them with a Google search.
And that is fightcancer.org. So that's the website for the American Cancer Society Cancer Action Network. Yeah. That's the advocacy arm, fightcancer.org.
Perfect.
The American Cancer Society itself is cancer.org. And Above and Beyond Cancer is aboveandbeyondcancer.org. So all organizations that are involved in advocacy around cancer control.
Perfect.
Any other questions? So Kelly, thank you so
Yeah. Oh,
much.
thank you.
The work that the Iowa Cancer Consortium does is so important and so collaborative. It's really about bringing people together. So
Yeah.
thanks for helping us inform everyone about
Yeah.
the Iowa Cancer Consortium. I hope many of you will consider becoming members for $0 or $20 a year and participate in our spring meeting. And thanks again to everyone who attended this evening. If you would like to listen to this again, or if you know someone that you think would benefit from this, this program will be available on demand tomorrow at the Above and Beyond Cancer YouTube channel, or it will be available soon at the Mercy Cancer Center website. And we're also going to be sharing the link with the Iowa Cancer Consortium. So I have a feeling that you might even be able to find a link to this podcast at Iowa Cancer Consortium.
Definitely. Thank you so much.
Great. Thanks, everybody. Hope to see you next week. Thanks for attending.